Well, good morning or good afternoon, everyone. This is Joy Burkhardt. I'm the founder and executive director of 2020 Mom, and we're so thrilled that you're with us today for the third webinar in our Innovation Award winner series. And we want to welcome our guest, Kelly Kay, the executive director of Maternal Mental Health Now, and say congratulations to you, Kelly, for your work in helping to pass the California bill package. Before we introduce Kelly officially, I wanted to thank our funder for the program, the Innovation Award program, the Zilma Foundation. With their support, this program has run for 3 years and has brought the best practices to all of you who are interested in advancing change in maternal mental health to the field, again, for 3 years. So thank you, Zilma Foundation. Kelly, I'd like to welcome you again. I'm just realizing that I do not have your bio up, so I'm going to ask Christina, who's on the line. Christina, if you have Kelly's bio up, please go ahead and introduce her and first introduce yourself. And Christina, if you don't have it up, I'm pulling it up quickly so we can officially introduce Kelly. And in the meantime, please go ahead and introduce yourself, Christina.
Hi, I'm Christina. I'm the program manager for the Innovation Awards this year, and it's been a pleasure to run that program and see all the amazing things that everybody is doing. I do have that bio up. Do you want me to go ahead and read it, Joy?
Yes, please. Thank you.
Okay. Kelly O'Connor Kay, Executive Director, and oversees the programmatic fundraising and marketing operations of the Maternal Mental Health Now. Her goal is to ensure that all Los Angeles County's new families have the resources they need to address maternal mental health disorders so that they can grow and thrive. Kelly previously served as Maternal Mental Health Now's Development Director for 7 years. Before joining Maternal Mental Health Now's team, which coincidentally corresponded with her own transition to motherhood, Kelly worked for a number of nonprofit organizations in the human services and environmental fields in the U.S. and the U.K. as a freelance fundraising consultant and staff member. Kelly is a graduate of Northwestern University, having received a BS in Communication Studies and Sociology. She also holds an MS in Elementary Education from Brooklyn College, part of the City University of New York. Welcome, Kelly.
Great. Thank you, Christina.
Thanks, Christina.
And welcome,
Hi,
Kelly. Hi, Kelly. Great. I see a few folks. We want to just remind folks that you're welcome to introduce yourself to all of us using the question feature, not the chat feature, in the GoToWebinar control panel. We'd love to actually know what state you're in. I can see Nicole Miles from Chicago. Nicole, it's great to see you, and several other familiar names and faces, or not faces, but names. So glad so many of you are here. And Lola is saying hello to Joy and Kelly through the chat feature here. So hello, Lola. Thank you for the welcome. And hi, Nicole. Great. We have a nurse practitioner, psychiatric nurse practitioner on the line from Washington. Some good work has been happening in Washington as well. Welcome, Patricia. Great. So the rest of you, feel free to say hello through the question feature, again, on your GoToWebinar control panel. And we also want to welcome those of you who aren't watching live with us right now, but the recording. And we're glad that you are joining us to receive the information from Kelly today about the maternal mental health bill package that passed in 2017 in California. So Kelly, it's great to have you. I want to start by having you tell us a little bit about Maternal Mental Health Now and also your mission. So I know we've got that up on the screen. Tell us a little bit about the community you serve and the organization's mission.
Sure. Well, thanks for having me today, and thank you so much for the award and the recognition. And we couldn't have done it without you in 2020 Mom. But to start, Maternal Mental Health Now is a Los Angeles-based nonprofit organization. Our mission is to remove the barriers to the prevention, identification, and treatment of perinatal mood and anxiety disorders in LA County. We were founded in 2007 by a woman named Kimberly Wong following her own experience with severe postpartum depression. And despite being well educated, having a strong support system in place, having means, she had a lot of trouble finding help and recovering. So she, upon her recovery, she started working the phones and calling a bunch of stakeholders, people at the county, Department of Public Health, and so on, and started convening these meetings. And Maternal Mental Health Now was formed. At the time, they were called the Los Angeles County Perinatal Mental Health Task Force. Now we're about 12 years later, and we have 3 main program areas. The first one, and our primary one, being training and technical assistance to healthcare providers, social service providers, and community-based organizations that are serving new moms and their families. And we're training them on how to screen and how to treat and how to refer families in need to appropriate resources. We do public awareness and stigma reduction work. And we also have a policy director who oversees our policy and advocacy work, including the bill package that passed 2 years ago.
Great. Thank you. And thank you for your work. I think probably many of you on the phone right now are thinking, wow, I wish we had a Maternal Mental Health Now in our community, and really is the model in the organization that has been doing maternal mental health community-based work for a very long time and well established, and really has drawn in great funding. So it is a model that all of us should be looking to. So thank you for your amazing work. I will also say, just for context, that LA County is the size of the state of Massachusetts. So for those of you who are thinking like, what kind of community-based work and scope, it's a big scope that Kelly and her organization are leading, and the reach is quite large. So that's great, Kelly. Thank you so much for sharing that work. So we're going to start by asking Kelly, how did all this work come to be? And before we do that, we want to remind you that we're really celebrating the passage of 3 bills that passed in 2017. So just to lay the groundwork, we're going to ask Kelly to walk us through the timeline that she so nicely put up here on the screen. So how did this all start and come to be?
It all started back in 2014 with the passage of ACR, which is the Resolution 148, which was sponsored by the California Legislative Women's Caucus. And the resolution requested that the California Maternal Mental Health Collaborative, which is now known as 2020 Mom, establish a task force on the status of maternal mental health care. So 2020 Mom took a leadership role in that, and convened more than 20 appointed members of various stakeholder organizations, as well as advocates and mothers. And this group met for a year between June 2015 and June 2016 to study the maternal mental health landscape across the state of California and review programs outside of the state that have begun to address maternal mental health issues through legislative actions. I'm sure you can, there's much more detail to that, Joy, and I'm sure you can fill in the blanks, but ultimately that task force produced California's strategic plan, a catalyst for shifting statewide systems to improve care across California and beyond. So that's the white paper that was published in 2016, and it summarized findings and issued recommendations to the California legislature, and it provided, as well as other public and private entities.
That's great. And we're going to just invite any of you to submit questions that you have real time through that question feature on the GoToWebinar control panel. But Kelly, I think we can keep going. This is great. It's so nice to see all of these photos on one timeline.
Yeah, so the white paper issued, I think, at least 12 different recommendations. And the 3 bills that are part of the bill package came out of those recommendations. So what happened next was there was a rally held on the steps of the state capitol in Sacramento. And the result of that rally was we secured offers for all 3 bills. And then we went through the legislative process, which was negotiating the content of the bills with supporters and opposition, working with those authors to make sure that stakeholder comments were received and reflected in the content of the bills. Letter writing campaigns. We provided testimony at the health committee hearings. And that, I think, was the most fun part of the whole experience. There was one health committee meeting where, thanks to Joy and her team in Northern California, a bunch of moms came with their toddlers to provide support statements to the bills that were being considered. And you could sort of hear the buzz and all the little, the babies and the toddlers and all that chatter that comes along with that. And you could see the members of the health committee reacting to that. And we had a long line of people saying, I support this bill. I'm a survivor of postpartum depression. I support this bill, and so on and so forth. And then we also had some real moving testimony from survivors and healthcare providers that at those committee hearings. So the photo on the timeline is Marquita Sandoval, who happens to be a labor and delivery nurse, but she's a mom of two. And following her during her second pregnancy, her symptoms started during pregnancy and continued postpartum. And her story, she describes reaching out for help at so many different times and places. And she kept hitting these barriers, such as one doctor's office said they would call her back that day, and 3 days later, she hadn't received a call back. She describes getting a list of referral resources, and none of the numbers were working. And finally getting an appointment with a psychiatrist, but it was like 6 weeks down the road. And within those 6 weeks, she started having intrusive thoughts. And so her story really illustrates the barriers to maternal mental health care that our bills were seeking to address. And who else is in the photo is Dr. Einav Acourt, who's a research psychologist who works at Cedars-Sinai Hospital. The two of them provided testimony for AB 2193, which I'm sure we'll get to in a minute. But she provided like the healthcare provider standpoint. And at Cedars-Sinai Hospital, they have a very strong screening, education, and referral program. And so 99% of the women who deliver at Cedars are screened before discharge that she established. So there are other testimonies as well, but that's the photo that I included there. And I thought it was a really meaningful and moving testimony, which certainly helped push the bills forward through the process.
That's great. Thank you, Kelly. One of the questions we like to ask our winners and also honorable mentions, those that present their programs through the Innovation Awards program, is talk to us a little bit about the funding or the champions that were necessary to put this work into play. And why don't we start, Kelly, by asking, like, once this report was issued, and I'll just add that it was issued to the public, but also to the legislature, and that the goal of that report wasn't necessarily that legislation would have been introduced. I think many of our stakeholders would not have participated if they thought that, the main goal of issuing that report was to pass legislation. Instead, the goal was to create a strategic plan for the state with multi-stakeholders at the table, right? The California the California Hospital Association, the California Health Plan and Health Insurer Association, the AWHONN, the Obstetric Nurse Association was represented. Some key large health systems were at the table, and many others, departments of public health, etc. And no one really wants to be told that they must do something through passing legislation. And so just wanted to share that the goal wasn't to pass legislation, but to share a strategic plan. And it would have been great if all of this happened naturally. I will also add, Kelly, if you don't mind, that one thing that really propelled change, I think, was the task force wanted to make sure that there was a goal that was set to measure progress against the recommendations in that strategic plan. And they decided that there should be a goal. The easiest way to kind of measure progress would be to set a goal on screening rates. So how often screening was occurring. And the goal that was set was to see 100% of women be screened by the year 2025, which perhaps is not realistic, but the task force felt was critical to say all women deserve to be screened. So let's stick with 100%, even recognizing that won't be achievable for various reasons. And that by the year 2021, that 80% of women should be screened. And of course, how close is the year 2021? So because there wasn't movement within leadership organizations like ACOG, the American College of Obstetrics and Gynecology, and others to do this work on their own to promote screening, the legislature really took note that how else are we going to do this, right, without implementing policy. So Kelly, from there, tell us a little bit about like what kind of effort did it take your organization to commit to running legislation, sort of startup funds and things like that you might touch on?
Sure. Well, as it happens, we have a part-time policy director on staff, and that was made possible, let's say, 8 years ago due to a grant that we received from First 5LA from their policy and advocacy funds, and it was a 5-year grant, so it was significant and allowed for sustainability in that position. Unfortunately for us, after that 5-year grant sunsetted, First 5 didn't make that funding opportunity available to us again, but we were able to sustain the position and keep the position on staff due to other fundraising that we've been doing, which is primarily grants. We are fortunate in that we receive a lot of general operating grants, so we are able to spend that money on any need that we determine, as well as individual fundraising events and appeals, as well as some earned income strategies. So we really did not have a direct funder for the policy and statewide advocacy work that we engaged in, but we were able to support that work through our general operating funds. But that year was the first time. Prior to that, our policy and advocacy work really focused on Los Angeles County, and I would attribute the decision to get involved in the statewide advocacy work to you and you, Joy, in 2020 Mom, because you knew the statewide landscape, and I think we had the track record in LA County to access the healthcare providers to support the bill, and the women with lived experience to support the bill, as well as the training, expertise, and capacity to do that.
That's great. Yep, that's exactly right. Really great to partner for so many reasons with multiple organizations that have the same goal around state policy work. That's great, and thank you for sharing the backdrop on policy and what it took to kind of fund the work from your perspective. Kelly, would you mind asking or answering a question? So for those that are on the line that may be affiliated with a nonprofit organization that would potentially be willing to do much of this work, but perhaps you all on the line aren't paid staff, but volunteers with that organization. Kelly, do you have thoughts on whether it does it require a paid staff member to do this type of work from your perspective, or could it be led potentially through some grassroots efforts as long as there was the connection perhaps to a nonprofit that's well recognized?
It really comes down to time, right? Time and passion. So I think if you have a passionate group of people who are willing to give the time, then it doesn't require a paid staff member at all. And I also think that in a way it's preferable that these legislative actions are coming from the grassroots level, because that's where the need is. So I think in terms of telling the story and illustrating the need for these laws, coming from survivors or healthcare providers that are serving the survivors, I think that makes for a very compelling story.
That's great. And folks, feel free. There's 27 of you with us on live. If you have questions about any of that, or perhaps you have thoughts about the organizations you're working with and would they be a good fit to do any of this, feel free to share your thoughts or ask your questions through the question feature in the GoToWebinar control panel. That's great, Kelly. And do you mind, Kelly, just talking a little bit about, we talked about volunteers and paid advocacy folks that are on your team, or an advocacy, part-time advocacy director. Talk a little bit about whether a paid lobbyist was used to do this work, and were other organizations using paid lobbyists to perhaps oppose the bills, et cetera. Do you mind touching on that?
Yeah. Yeah, we didn't use the paid lobbyists to support the bills at all. We don't have the budget for that. But the opposition did. And certainly we had some meetings and phone calls with those lobbyists from the California Association of Health Plans, one of them. The other main opposition of AB 2193 was the Chamber of Commerce, right? And yes, the lobbyists for those organizations met with the staff in our author's office, and to try and negotiate the content of the bill, but ultimately, and for us, try and convince them of the benefits of the bills and how it would benefit them in the long run, in the long term. In both cases, in terms of 2193 and 3032, there was an upfront cost, but potential long-term cost savings. And that's what those conversations looked like, was sharing that kind of data. Ultimately, those two oppositions opposed the bills, but I think that our testimony and our letter writing campaigns and so on was effective in overcoming that opposition.
Yeah, that's great. The grassroots voice won out, right? And it does seem that it's often unique that the legislators aren't hearing from everyday people and constituents, right? Those who vote, their district members. And so it was quite powerful. That's great, Kelly. The last thing on this slide that's jumping out at me that I'd love for you to touch on, and we can touch on it together as well, is that picture of the rally. And what I thought would be helpful to highlight is that Jessica Porton, who that name may sound familiar to some of you who've been following maternal mental health for a while, but this rally was actually held in response to one mother sharing her story on social media, and it went viral. And it was about her experience speaking up about intrusive thoughts, unwanted thoughts that concerned an uneducated OBGYN's office, concerned them, and they called the police to escort her to an emergency room where she was kept overnight and never received any kind of treatment. So there was concern about potential harm coming to her baby because there's misinformation, right, about intrusive thoughts and providers not understanding the difference between those thoughts and psychosis, where we do have an increased risk of harming oneself or others, including babies around that mother. So what was really great about that rally was it just happened to tie in so nicely with interest in the legislative process from legislators already after that report was issued. And we decided we should be rallying for change on the Capitol. So she's there in the middle holding her baby. And then there were 4 fathers who were already engaged in this work who lost wives and or spouses and babies to these disorders, and additional news media covered their stories through the NPR outlet. So just want to share that, your local stories can help propel change and advance, passage of legislation as well. Kelly, do you want to add anything else you want to add about news media or stories that came out of this work? And I'm thinking about one story in particular that didn't actually cast our legislation in good light, but still drew great attention to the bills. I think there were some other great stories that all of our organizations were involved in. Anything you want to share? Yeah, about the media?
Well, the other thing about Jessica Porton's story, and there's, for that story, I'm sure there's thousands more, right? But if something like that happens within a legislature's jurisdiction, I think that is a prime opportunity to get a champion for the issue on your team and on your side, and to kind of start that legislative process if that is a goal. So I just wanted to share that regarding personal stories, and but in terms of media, actually I'm not sure which which piece you're referring to, but there was certainly, I wouldn't say we were inundated or overwhelmed with media requests at all, but we did receive some media coverage. One of them, the one that I remember mostly, was from a reporter who covers LA County, and her beat is specifically early childhood development issues. So Maternal Mental Health Now had an established relationship with her because of that. In fact, her position was funded by a funder, a funder that we have in common. So the funder is specifically interested in early childhood development, and one of their strategies was to fund a reporter position at a local NPR station to cover these issues and raise awareness. And who knows what that awareness is going to lead to. And in our case, I think her coverage was supportive of the legislative actions that we took years ago. And I think that it was helpful from the author's point of view, because these assembly people need to run, to maintain their positions if they want to stay in office. And so if they're able to lift their profile from positive media attention, having authored bills that are really important to their constituents, then they're better off for that. And so I think in that case, from that perspective, the media coverage was helpful, but it wasn't necessary. I wouldn't attribute the media coverage to our success, right? I think it was helpful, but it wasn't essential.
Great. Yeah, that's helpful. One other thing, Kelly, that's jumping out at me, and then we're going to move into the bills. Some of you may be really interested in what do these bills require? That's where we're going next. Wanted to point out that in California and in many other states, one thing that even happened before ACR 148, that resolution that calls for the establishment of a task force on maternal mental health, and actually called for private funders to fund that task force paper, which was helpful in many ways because it didn't require state funding, and also brought some new funders to the table after the resolution passed. That the resolution was taken to several funders, and they went, wow, if the legislature thinks this is important, then we should fund it. So it was helpful in that way. But I also wanted to share, even before ACR 148 was introduced, there was additional efforts before that to lay groundwork around maternal mental health, which is always helpful. And Utah, who received the Honorable Mention Award in this category for advocacy and presented last week, they actually had introduced resolutions just to declare the month of May Maternal Mental Health Awareness Month. Michigan has done that. Other ready states are starting to start with a resolution to kind of educate the legislature and have laid a little groundwork before other heavy lifts come to them. So I wanted to share that also happened in California. ACR 105 was the awareness resolution that declared the month of May Maternal Mental Health Awareness Month, and those resolutions include all sorts of statements like, whereas up to 50% of women living in poverty may suffer, whereas up to 20% of those not living in poverty may suffer from these disorders, whereas it impacts child development, whereas you sort of make the case in educating the legislature on these issues, and then you bring bills that might require a lift to the legislature. So let's just see if there are any questions that have come in, and don't be shy and ask a question. We don't have any right now, but if anyone does have thoughts on any of this, we'd love to hear from you. I think now we're going to jump right into the bills. So Kelly, I'm going to go ahead and advance, and you can walk us through the first bill.
Okay, so AB 1893 was titled Maternal Mental Health Federal Funding, and this was in response to what we had in mind was the Bringing Postpartum Depression Out of the Shadows Act at the federal level, which was making funding available. What it turned into was a request for proposals for 7 states to create a psychiatric consultation line and maternal mental health training program for healthcare providers in the state. And so our goal was to make sure that California applied to that. and the other future funding opportunities that come up. So that's what 1893 was all about. And as it says on the screen, it required the State Department of Public Health to investigate and apply for federal funding opportunities, and for the department to report back to the legislature that it had done so. I remember that there was some conversation during the legislative process was like, well, which department at the state level is responsible for doing this? Like, which department should we target? And, some of the feedback that we received was that the Department of Public Health really thought this was something that belongs in the Department for Health and Human Services and vice versa. But ultimately, we targeted DPH. And the outcome, so this bill passed. It became effective on July 20th, 2018. And the state of California did apply to that federal funding opportunity, but we were unsuccessful.
That's right. Very good. And you wouldn't necessarily need a bill to address this, right? Kelly, I think what we ran into in California was that there was no one state agency that thought maternal mental health fell within their jurisdiction for various reasons. In most states, or many states, we find that the Department of Public Health really is taking on maternal mental health and takes ownership for the cause. But here in California, for a variety of reasons, that hasn't been the case. And so we wanted to make sure that at least one agency was on point to apply for that grant. All right, let's move on to the next one. And just for those who are interested in knowing, well, do those grants still exist at a federal level? There should be additional funding. There were 7 grantee states that received funding this last year, and there should be additional grants that become available soon. So be sure that you sign up for 2020 Mom e-News to learn when those grants become available through HRSA. All right, let's move on to AB 3032, Kelly.
So this one is titled Maternal Mental Health Conditions, Education, Early Diagnosis, and Treatment Act. And what this does is it requires all birthing hospitals in the state of California to provide education on maternal mental health disorders to both their providers that are serving new mothers and families, and also the patients. So what the providers include all labor and delivery staff, including registered nurses and social workers. And the hospitals are being required to document what that plan looks like and report on it. And this becomes effective on January 1st, 2020.
That's great. And feel free, don't be shy to ask questions. Kelly, what I'll add is that these were part of the stakeholder recommendations, multiple stakeholders involved in that task force, and the strategic plan included recommendations for all of them and the roles that everyone must play. It takes a village, right, even in the health delivery system. One of the things that we found interesting, right, Kelly, was that the Trade Association for Hospitals didn't actually push back much, and they actually helped drive and write the policy that ultimately got passed. Kelly, is there anything that you want to share about this bill and the difference maybe between this one and the next one in terms of passage and heavy lift?
I just that this one seemed to be easier. It was less controversial, and we had less opposition for it. Yeah.
Yeah. And I'll also add that the first draft of this bill actually we thought it was an easier ask. It asked hospitals to develop programs to address maternal mental health, and it didn't define what those programs would be. The fact sheet, which accompanied the bill language, provided examples of things like provide services to your NICU patients, or screen high-risk women when they're inpatient for whatever reason when they're pregnant, like screen them and provide support services, provide support groups in the postpartum period for maternal mental health disorders. So there was a range of things that we listed as examples of possibilities, And we learned that in California, they didn't like that version, and they rewrote the bill, the Trade Association for Hospitals. And we later learned that California doesn't require, what we said, monitor the effectiveness of those programs, whatever they might be, through your quality management committees, and alter them as needed to drive impact. And we learned later that there is no requirement for hospitals in California to have quality management committees. So they didn't like that first version, but then helped rewrite the bill, which was the one that passed. So there's always an interesting, backstory, perhaps. But once they rewrote the language, which we were still satisfied with, not knowing that there wasn't a requirement for quality committees initially, which is a whole nother, opportunity for the healthcare delivery system. It was just great that this then sailed through with no opposition from the Hospital Trade Association. And Kelly, I think we have one question that came in. Let's see if we can answer it now. So, there is a nurse from Huntington Hospital here in California that's on the line. And Christina, I might need you to read this question for me. So I see that we know Huntington Hospital, just for those of you on the line, is based here in Pasadena, California. And Christina, are you able to navigate the question in the GoToWebinar? Thank you.
It says, hi, I'm an inpatient RN and IBCLC working at Huntington Hospital, Pasadena, California. I'm wondering how AB 3032 will be enforced. Will hospitals need to report out how and what their training consists of? I can't scroll down. We run, It's not letting me scroll down.
Yep, that's the challenge, isn't it? Okay, I think we got enough of the question there. Kelly, do you want to talk about enforcement? And really, I think it's applicable to this bill, AB 3032, and also 2193, which I now have up on the screen. Do you want to touch on that, Kelly? And I can also fill in if helpful.
My understanding is that hospitals will be required to report to fill in the department, please, but what their training program looks like or what their education program looks like. I might want to take this opportunity to say that Maternal Mental Health Now is working on some projects and raising money for some projects to support hospitals with the implementation of this bill. It's premature to say that is going to happen, but I'm optimistic, and based on funding, but if that finish doesn't come through, we can serve as a resource. 2020 Mom can serve as a resource as well as others in terms of what it needs to be compliant with the bill.
And we're happy to answer questions offline for any hospitals in California about the reporting or oversight components. There's also a line for women to report problems that they're experiencing with regards to 3032, which Kelly just talked about, or also 2193, which she'll talk about now. So if, for example, a hospital doesn't provide education, a mom can report that problem through the licensing agency, which is the Department of Public Health in California. And that's how, based on the number of complaints that are received on various issues, that's how the agency knows that they need to do a little bit more to enforce. So that information is on the 2020 Mom website on a fact sheet for moms about the California laws with regards to how to report those problems. Kelly, let's move into AB 2193 and talk about this bill. This was the big one that got a lot of news, press, and lots of attention and opposition. Kelly, do you mind first, before we talk about what actually passed, do you mind touching on that case management component, so the initial legislation, and what maybe got peeled out and why?
Sure. Yeah. The 2193, the goal of it is the screening mandate, but we didn't want to mandate screening without giving them the appropriate support or resources, or when they encounter a high-risk patient, someone who screens positive. So the first iteration of the bill included a mandate for healthcare plans to create a program that would address maternal mental health disorders and provide a case management service to the screening doctor they can refer the patient to. So not only the patient gets referred to a treatment resource, but then there's a case manager similar who's tracking that patient through treatment to make sure that they get to that follow-up appointment. And that's what the first version of the bill consisted of. But through the legislative process, we received a lot of pushback from the Association of Healthcare Plans as well as from the Chamber of Commerce because of their interpretation was that this service, this case management service, is going to cost them money, and that money is going to be passed down to the businesses. So it was really a financial argument. So we had a lot of opposition from those two players mostly, and so through the negotiation process, that part of the bill there's still a piece in the bill about maternal mental health program, but it was weakened. The case management piece was taken out.
That's right. And Kelly, I will add that what we found interesting is that the staff that was supporting the bill in the author's office, Brian Mainshine's office, the legislative staffer, the legislative director, was assigned to this bill, and she had a twin sister who suffered from a maternal mental health disorder, and her personal passion was to see screening happen. And so that was one of the reasons why it was screening that was kept in versus case management. Like, what if we're going to kind of fight one set of players in opposition? Which would we fight? And I think her personal story and interest in screening led to the fact that the case management piece was dropped and screening was kept in. So, right, Kelly, it's not always the stakeholders that have the say in the end. The legislative staff can really modify a bill as they see fit, and we'll take, hopefully, if you have a great relationship, we'll take feedback into account. But she really felt passionate about the screening piece, so it was kept in. Kelly, anything else you want to add on that bill?
No, I think we covered it.
Okay, great. Excellent. Well, we're going to move into Q&A, and I do see the rest of the question that came in from our Huntington Hospital champion asked about the requirements around training patients and educating, it was Melinda, educating women. And so the question is, do we also have to do screening in a hospital setting? And Kelly, I think you can address that
yeah.
The bill doesn't require screening. Anything you want to add on that point?
Require screening. It's just required. I think there's different levels of provider education as well as patient education. And the bill requires a minimal level, right? So how a hospital chooses to provide that is up to their discretion. We believe, Maternal Mental Health Now believes, that screening should happen before discharge, as well as, we believe it should happen in all well child visits throughout the first year of life or 2 years of life. So I think that's best practice, and that's something for hospitals to strive for, but the bill does not require that.
That's right. And I'll just add that the white paper, that strategic plan that was in the timeline that Kelly went over, called out the fact, this white paper here, which is available on the 2020 Mom website if anyone wants to download it, but it did call out the fact, similar to what California experienced, that there's no one state agency that wants to take ownership or lead on maternal mental health. It called out the fact that providers are struggling in the same way, that an obstetrician may say, like, I'm not trained in mental health. My expertise is like in the lower half of the body, not the head, right in the brain. And that's really psychiatric providers that should be providing that support. Psychiatrists might say, it's not me. I don't treat pregnant women or have expertise in medications, for example, that are safe during pregnancy and lactation. Pediatricians might say, like, we understand the importance and want a loving, thriving mother to be engaged with the baby. We understand that importance, but we're not the patient's provider and can't really treat her. And so it's not really us, right? So we see this sort of ping pong effect, as one organization has called it, happen in provider settings. Hospitals might say, like, all moms are stressed when they're delivering, and when we have a lot of false positives. So it's really this challenge of who should really be doing this. And the white paper here called out the fact that obstetricians should be the home base for screening, and that there should be no wrong door. Every provider type should be prepared to screen, and ideally screening routinely and coordinating with the obstetrician. And the reason why that was the case, that the task force saw the research that indicated that many women have new onset, almost as high new onset of maternal mental health disorders in pregnancy as in the postpartum period, and that it can be a leading cause of preterm birth, and that also we have many young childbearing age women now that have pre-existing depression or anxiety that hasn't been treated, and that needs to be detected even pre-conception, but definitely during pregnancy. OBGYNs or obstetricians are also able to develop treatment plans and are treating providers for women, unlike pediatricians. And so really the home base, if there's to be one home base where providers will always screen, would be the obstetric setting. So just wanted to add to that. Good. I think we have one more question that has come in. We have a comment about hopefully we can scroll down. We're having some problems, I think, with our platform here. How about educating families about these disorders? Many MDs state they're reluctant to screen and respond because, let's start with the first question is, how do we educate families? And Kelly, AB 3032, encompasses some of that. Do you want to touch on that?
I mean, there's many opportunities to do that, and it depends what families are in the hospital with the mother or visiting the mom. And we've seen hospitals that, there's literature that you can provide, there's videos you can watch, there's even apps that, you can encourage a family or walk a family. I think it's important to just use every opportunity that you get to engage with a family and just plant the seed. Because a mom may not be feeling or just displaying signs of symptoms of perinatal mood anxiety disorder days after delivery, but she may do so 2 months later, 6 months later, or so on. And if that seed is planted, and if that literature was provided or that URL was provided, that may spark something in the family member to remember that, go back and refer to it, and then get their loved one treatment.
That's right. That's great. Thank you, Kelly. And 3032, the hospital bill, it really is about educating families or whoever is there to be educated about that. One thing I'll add about 3032 that I think the second question might address is that because 3032, the hospital bill that educates patients and requires education of all clinicians in the hospital setting, but when patients are educated or their families are educated, they also have to provide information about any local treatment options. And because most communities don't have adequate treatment options and referral pathways, we think it'll really start to prompt hospitals to want to do more around developing treatment, including the programs that we've already mentioned, like outpatient support groups, which hospitals do such great work around lactation. So it's very similar to creating support groups for maternal mental health disorders, for example. Many hospitals, including Huntington, and I shouldn't say many, some hospitals have developed outpatient day treatment programs to serve an unmet need. And so we know Huntington Hospital has an outpatient treatment program. We know that insurance, and I think one comment here is insurance can be a struggle for treatment, and that is true. There are some struggles around insurance on a number of fronts. So we've got some thoughts on some of that around the payment of treatment programs and ensuring adequate rates so that providers can join networks, insure networks, and be able to cover their overhead costs if they're billing insurance companies, and the additional work that comes into play there. So if anyone does have questions about insurance, feel free to email either Kelly or myself. We'll go ahead and wrap up today's webinar unless there are any other questions. And, we are actually having a little trouble, I think, with our platform here to get to all the questions that are coming in. So I'm going to actually pause and see if there are any attendees that are on live. You can use the raise your hand feature on the GoToWebinar control panel. It's on that little black or dark gray bar on the outside of your control panel. You're welcome to raise your hand. And if you have a question, we can open your line. Good. And I saw one person raise their hand, and perhaps one has dropped. Okay, I'm going to just give it one more minute. You can put your hand up. There's no hands up right now, so if you want to raise your hand and ask a question, we'll open up your line. And hi, Susan, and I'm seeing some other familiar names, and Lily and Adrian. Good to see all of you. All right, so we don't have any hands up right now. Feel free to email either myself or Kelly. And Kelly, we don't have your email up here. Do you want to go ahead and share your email address?
Sure. It's Kelly, K-E-L-Y, at maternalmentalhealthnow.org.
That's great. And joy at 2020mom.org is my email address, joy at 2020mom.org. Feel free to email us about those insurance questions. We're happy to help. And I see one insurer on the line, too, from Optum, so welcome, and you might have some thoughts around reimbursement opportunities as well. Thank you all so much, and again, thank you to Zoma for funding the Innovation Awards program, and also congratulations to you at Maternal Mental Health Now, Kelly, and your team for all of this hard work, and also the full network in California of mothers and providers who helped champion the passage of these 3 laws. I also want to congratulate the California team for passage of one more bill that passed in 2018 around education opportunities for MDs, and know that there's more to come in California. So for those who are interested in watching, sign up for the e-news with Maternal Mental Health Now, and 2020 Moms also sharing some of those news features on legislation as well. So Kelly, again, congratulations. And we're excited to see what happens in California. Thanks, everybody, for joining us today. And you can see on our slides the upcoming Innovation Award webinars that you won't want to miss as well. So we hope to see you all on an upcoming webinar. Thanks, everybody. And again, congratulations, Kelly.
Thanks, Joy.
Thank you.